If you're noticing ulcers, spider veins, or varicose veins impacting not just the health but also the appearance of your legs, you're not alone. These issues don't resolve themselves and can worsen over time. The good news, our next guest has solutions to help you feel confident and get back in stride. With us now is Dr. Tony Reincke from Reincke Vein Center to share how modern, quick, and comfortable treatments can make a big difference. Good morning.
Good morning.
I was with a friend this weekend. We were at the Nutcracker Market walking around, and she says, I got to rest. And I go, okay, you all right? She goes, my legs are aching. She pulled up her pant leg. I saw the bulging veins, an itchy, scaly patch that was discolored, and I thought, I'm not a doctor, but I play one on TV. It looks like vein disease. But I told her she should get that looked into. And she said, I'm afraid because her mother had vein stripping years ago, and she remembers that downtime process. You've seen plenty of that, but that's not what you're doing today.
That's correct. So it's dramatically changed since like 30 years ago when I was a surgical ICU nurse. They used to do vein stripping procedure. There was operating room time, general anesthesia, and then a 6-week recovery time. Now it's an in-office procedure done with ultrasound, numbing medication. The patient is back to normal activities the same day, no downtime.
Yeah, you know, a lot of people will say, oh, why does it always affect women and not men? It does affect men as well. I think sometimes for women, we might have a little bit more vanity attached to it, or that thing of just, pushing through. Men are like, I'm just going to push through.
Right. So that is really important and a huge emphasis for me, especially with minorities, is education and outreach. But certainly it's about 60% female and 40% men that have it. But it's just as important. And I'm trying to get the word out in the community about getting free screening sooner than later. So trying to get men not to wait until it's really advanced to get treated.
And not be afraid of the procedure. So, you became a doctor specialized in catheter-based procedures. You can be in and out.
Yes. I mean, literally, it's a very efficient procedure by its nature, but it probably only takes me 10 or 15 minutes from start to finish to do the catheter-based procedure. Patients don't describe it as painful. It's a little uncomfortable, more like a pressure sensation is what they've described to me. But again, like you said, they're back to their normal activities with no downtime.
Yeah, and I can't imagine it being any more uncomfortable than them having achy, tired legs and the whole bit. So let's go through some of the symptoms. We mentioned a couple of them, but what are some of the things that people can look at that show the early signs of vein disease and, of course, the advanced signs?
Okay, so earlier signs might be tired, heavy, achy, itching sensation, and then maybe like some burning along the course of their leg, especially from the knee down. A little more advanced signs of vein disease are skin discoloration, wounds that don't heal or skin that doesn't heal well, edema, which is swelling, and even open wounds that are not healing.
Yeah, and oftentimes people will go to a dermatologist for some of that, and they think, oh, why is it itchy and scaly and discolored? Or they'll think it's just a muscular issue and still not connecting the dots that it's about the veins and getting oxygen to their legs and muscles.
Correct. Yeah. So I think that is something, again, why it's such a big emphasis for me to do that outreach and education is to inform patients first and foremost that it even exists, and then let them know that those signs might not be just a skin issue, but maybe something just a little bit deeper.
Yeah. Okay. A lot of us have anxiety just going to the doctor's office. We think, okay, what's the evaluation process like? The evaluation process is fairly easy. It doesn't take a whole lot of time.
Correct. So we have been doing a lot of outreach with free screenings. So it's just ultrasound. We can tell you in probably 30 seconds whether or not, based on just a quick evaluation and history with the ultrasound, whether or not you have some backward blood flow. Yeah. And then, of course, coming into the office, we'll do a thorough diagnostic exam. We'll look at your arteries, your deeper veins, and then the veins I treat, which are more superficial. You still cannot see them on the outside. That's why we need ultrasound.
Who's most likely to have vein issues? And what causes it? Is there any way for us to prevent it?
Prevention, no. I think the number one risk factor is genetics. So if your mom or dad has it, you have a 50% chance. Both of your parents, it goes all the way up to 90%. Age over 50 for women, multiple pregnancies, men and women, obesity, and occupation where you sit or stand. So police officers, doctors, nurses, etc., teachers, somebody who's standing all the time because of that backward blood flow in the veins and the force of gravity.
The cost is another thing that stops a lot of people from coming in, but this is one of those things that most of the time is covered by insurance.
It is, depending on your plan. This is a great time of the year to get in with people hitting their deductibles. On a side note, I am doing some pro bono cases for patients. I did a Hispanic health fair recently. All the patients that showed up, none of them had insurance. So I'm going to be doing some cases for patients completely free. And one of my patients will start in February when she gets back from Mexico. That's not everybody. We also have payment plans as well. So we do take cash. But yes, most insurance plans do cover the procedures.
And that's part of what you do. You've recently won awards for your work in the community, and that's part of your community work as well. But another thing that makes you different is that, you work around people's schedules. They're talking directly to you.
Correct. Yes. We do have Saturday hours that we do just procedures. So that helps for people, anybody that works doesn't have to take vacation time or get a babysitter, et cetera. So we have Saturday mornings. In addition, I do everything myself from start to finish. So patients have access to me like 24/7. I give them my personal cell phone number.
Wow. All right, Dr. Reincke, I like high heels because my theory is the taller I am, the more I weigh what I'm supposed to weigh. So someone once told me, oh, high heels, it's not if, but when you're going to need some vein treatment. Please tell me that's not true.
I would tell you that if you're predisposed to having vein disease genetically, and then those other risk factors that we discussed, wearing heels just kind of changes the pressure in your foot and your ankle. So it's not contraindicated, but it's not going to serve you necessarily well. So there may be a point when you might have to go to a little bit lower heel instead of those 6-inch Christian Louboutin.
Yeah, no, I'll just come to you, Dr. Reincke. You'll take care of it. Thank you so much.
You're welcome.
All right. Reincke Vein Center has a special offer. Mention Great Day Houston to receive a free consultation. Call them at 281-394-4446. Again, that's 281-394-4446, or visit their website at reinkeveincenter.com.